The authors have no financial interest in this presentation.
As a beginner in phaco-emulsification surgery, having completed few of my initial procedures, I used to believe that I was doing very well. I examined one of my post-operative phaco-emulsification patients on the slit lamp, and I was worried to find stride keratopathy in the operated eye. I noticed that these features kept recurring frequently in my subsequent surgeries and were affecting the visual acuity of the patients. On reviewing the surgery videos, I found that a longer time was taken during the cracking step. In few of these cases, sutures had to be put at the side port. From the origin of Divide and Conquer by Dr. John Shepherd all the way to phaco chop by Dr. Paul Kopp, along with the newer karate pre-chop techniques by Dr. Akahoshi, one underlying step which has always remained critical in the process of phaco-emulsification is breaking the 10 millimeter nucleus. For phaco beginners, the Divide and Conquer is the cradle to successful phaco-emulsification. One core step in achieving this has been cracking. During my learning period, the single phaco step in what we call as the 7 steps of phaco had been a consistent failure for all my consecutive phaco steps. It was like misaligning the domino tiles, which when arranged properly would lead to a simplified phaco. Every budding phaco surgeon might have come across one such domino tile that was misaligned, and this does take a toll on the mindsets of a new surgeon. My Oscar scoring was on a record low with poor surgical outcome. In my desperation, I rummaged through available literature and found this article in a book. With this knowledge, I went back and reviewed my surgical videos. This is one of the cases during training in which the side port has been made at 3 o'clock position. The phaco probe and second instrument, which is the Sinski, are at right angle. But at this position, there is difficulty in placement and handling of the Sinski hook and dividing the nucleus. There is a corneal fold at side port. The nucleus is again rotated by 90 degrees and the separation process is repeated for the second groove with the same difficulties. A number of things went wrong in this procedure. Making incisions 90 degrees apart from each other, inability to effectively place the instruments well into the depth of trench, wound manipulation enough to cause corneal folds, zonular stretch, PCR, and struggle with nucleus cracking. Let us have a look at the prerequisites for an ideal cracking. First, there has to be ideal trenching. The ideal trench is one with adequate depth, adequate width, and adequate length. Secondly, positioning the side port at the right location. And thirdly, placement of the instruments and alignment of the trench. This results in an ideal crack with equal sized quadrants and reduced dissipation of unwanted ultrasound energy. Properly placed incisions are treated gently with no corneal folds, enabling effective sealing of the wound. As a phaco beginner, I would like to share my experience with an alternative technique that did wonders to my consecutive phaco steps. We have made a slight modification to the previous technique to achieve cracking with relative ease. Here we make a side port incision at 2 o'clock. Main port and side port incision are approximately 60 degrees apart and groove is placed around 30 degrees. Here the groove has adequate depth and length, and we found that we could easily place the second instrument. The probe is placed on the wall and second instrument is moved outward. Effortlessly, the nucleus is divided into pieces and there is no corneal fold at site port and no stretch on zonulets. At the end, we obtained a nucleus that had been divided into 4 separate pieces, each of which could be easily phacoemulsified. This maneuver was applied in the next 40 to 50 phacoemulsification cases, and we observed that the nucleus cracked very easily. The phaco time was less, there was good wound stability, the average surgery time was less, saline usage per case was also reduced. Post-operative visual acuity of patients was satisfactory and there was no corneal edema. The same method was applied in soft and mature cataracts, and cracking the nucleus into 4 pieces was much easier in both instances. Although this is not the conventional method for such cataracts, it was shown to be helpful for beginners as an alternative method. A large number of phaco surgeons have been trained. Most of the trainees encountered the same difficulties that I faced whilst using the conventional method. In most instances, trainees required the assistance of a phaco trainer to align the grooves so that the nucleus could be easily cracked. We taught this maneuver to 16 phaco beginners and found that they had a shorter learning curve with better results. With these changes, I saw what happened to the technique of nucleus cracking. This not only improved my Oscar scoring to more than 85, but also made great changes to my phaco approach. At the end of the day, it brought changes in me. With guidance from my seniors and my own experience, it made me more confident to tackle most phaco cases.
Thank you.
Thank you, Dr. Anjali. You really deserve an Oscar for at least admitting where you went wrong and sharing it with the audience. That I find most courageous. And of course, the part you showed, going back to the basics, the vector where, the vector lies where you want the break to be, crack to be. So that's very, important for the beginners. And the message is very clear. And some experienced phaco surgeons also here. Dr. Rajiv?
Definitely good presentation, and you highlighted the importance of some basic things. When we move forward, we sometimes miss the basics, which is you highlighted. It's a good for the beginners.
Thank you, sir.
I'm not sure, you said soft cataract also. Does it work really?
It is only shown to the beginner and how to that.
Another point, you have said that in cracking that angle, sometimes if you can cross-check, crack, opposite, then the angle may not be so important.
Yes, sir.
It is important when you are separating horizontally. If you cross it, probably that angle will not be an important one for that.
Thank you, sir.